Alright, so now that I've applied my PPE outside of the room, I'm going to enter. Go ahead and wash my hands if I haven't done so already before putting on gloves. And I'm going to knock knock. Hi there. And I'm going to close the curtain behind me for patient privacy. Hi, I'm Maya. I'm an ACC student nurse here. I'm going to be in and out all day, so I will be your nurse today. If you have any questions or complaints, you're more than welcome to contact me with your nurse call light. So I'm going to go ahead and do a physical assessment on you today. Do you mind while I take a look at your armband, verifying your name and date of birth so I have the right patient info? Mickey Mouse 81692. Okay. And then do you have any allergies? No allergies, just might be allergic to Dr. Pepper. Okay, no Dr. Pepper for you then. Okay, so we are going to start working from head to toe. Upon entry, I did assess patients' breathing, airway, any issues with circulation, and there were none. Sorry about the squeaking, I have my dog in here. And I did not notice any issues there. It's about a 60-second review of patient, any obstructions or anything like that. Patient looks happy and healthy so far. All right, and then on a scale from 1 to 10, do you mind rating your pain today? Oh, my pain's like at a 2. I don't feel any problems today. That's perfect. Okay, so I did notice that there was amber-colored pee in the urinal. Did you happen to go to the bathroom today? I did. Okay, and did you have any problems getting up to go to the bathroom by yourself? No problems. And did you have any problems urinating? Was there any pain? Oh, no problems. I peed just fine and it wasn't painful. Okay, that's good to hear. So we're going to start by assessing your vital signs. It looks like you have a blood pressure of about 120/80. I did read it with the cuff, wrap the patient's arm around, and assess. So it looks like about 120/80, which is perfect. I'm going to go ahead and assess your oral temperature, about 99.6, which is good. Dispose of the plastic cover. And then I am going to assess your radio pulse. While doing so, assessing your breathing, about 12 breaths, it looks like, per minute. And then your radio pulse is about 78 beats per minute, which is perfect. While I check your pulse saturation, your oxygen saturation, I'm going to put that clip on and notice that the patient has no clubbing in the fingers, which is good. All right, perfect. So all of your vitals seem to be good. Your oxygen level is about 96, so that is ideal. So I'm going to start by working from head to toe today. I'm going to start with your ears. Have you had any trouble hearing lately? No? Have you had any problems with seeing, your vision, or smell, or taste? No problems. Okay. I'm going to take a look inside your ear for any abrasions, any obstructions. Do you have hearing aids? No, I can hear just fine. Okay. And then I'm going to move down to your eyes now. There was no problems with the ears, no obstructions, no irritation to the skin. Now that I'm looking at your eyes, are you having any problems seeing? We said no. So I'm going to have you look at the bridge of my nose and while I do a sweeping motion. Okay, and then I'm going to also have you look at the pen. I'm going to pull it behind my head, down, across. Pupils look to be equal, round, and reactive to light and accommodation. Taking a look inside the nose for signs of nosebleeds, any polyps, any obstructions. Everything looks to be good as far as the mucosa. Taking a look at the lips now to observe any pink, reddening, flaking, or anything like that. Patient's lips look to be healthy, no dehydration issues or anything like that. Do you mind saying ah for me while I take a look at the inside of your throat? So I'm observing that I'm looking at the patient's teeth, their gums, the tongue above and below. We're also going to be looking at the patient's uvula and tonsils. While we're looking at the tongue and the gums, we're looking to make sure there's no signs of ulcers, no inflamed tonsils or uvula. Looks like there's not really any redness, mostly just pink mucosa and no irritation there. So looks like everything is perfect there. I'm going to start by assessing these pulses, the temporal and the carotid, while we're here. And then we're going to go ahead and move down. So if you don't mind just breathing normally, have you been having any chest pains lately? No? Okay. So I'm going to go ahead and listen to your heart here. I'm going to start by listening to your aortic heartbeat. This is to the right of your sternum in like the second intercostal space. It is an S2 sound, while to the left of the sternum is the pulmonic heartbeat, and it looks like it is also an S2 sound. It is in the same second intercostal space. I'm going to move down over to your tricuspid pulse, and it looks like it is in the S1 space, is an S1 sound. It is about mid-sternal in about like the fourth intercostal space. And the next would also be an S1 sound. It is your mitral or your apical pulse, and it is an S1 sound as well. This is in the fifth intercostal space. And I'm assessing for rate, rhythm, any kind of issues with that. Doesn't look like the duration, there's any problems there, so everything looks good as far as that goes. And then I've assessed your heart rate and everything there. While we're here, I'm going to take your ulnar and radial pulses, as well as check your capillary refill. This is called a bronch test. I'm going to squeeze the little fingertips and make sure that there is good refill within or less than 3 seconds, which it looks like there is. And then while we're here, I'm going to be assessing you for jugular vein distension. So we're gonna have you lay at a 45-degree angle. Does not look like there are any issues there. Everything is within patient norm. Okay. And then I'm gonna go ahead and have you lean forward for me. We're gonna go ahead and check your breathing. So if you don't mind just breathing in and out for me. And while I'm doing this, I'm going side to side. And I'm checking for any abrasions or issues with the patient's skin from sitting down for so long. Doesn't look like there's any issues with the integumentary system, no reddening or anything like that. Okay, and Mr. Mouse, I'm gonna go ahead and do the same in the front side. So I'm gonna lower this blanket here and listen. So the first normal sound is the bronchial sound. This is going to be closer to the trachea. It's going to be the harsher and heavier sounds, but that's just because it's up here. Then we're going to go to the bronchial vesicular. This is going to be toward the mid part of the lungs. And then we're going to go down to the vesicular sounds. These are at the lower part of the lungs, and they're deeper sounding. Okay, perfect. Everything looks to be good there. I don't hear any sounds of rhonchi, crackles, or wheezing, which is a great sign. And then since we're checking on your refill, I do want to take a look at your calves, make sure there is no tenderness there before I go ahead and palpate. Are you having any problems with your calves? No issues. Okay, I'm going to go ahead and palpate, pull, pinch and pull here. Everything looks good. Perfect, no tenderness. And then while we're over here at the skin and the fingertips, I'm going to do a little pinch. It's not going to hurt at all. I'm just making sure that you're hydrated. And it doesn't look like there's any tinting of the skin, so patient is fully hydrated. All right, and so now we're going to go ahead and move on to the gastrointestinal area. So I'm going to go ahead and pull the patient's blanket back, and you just let me know if you're uncomfortable. Are you having any stomach pains lately? No? Okay, that's good to hear. So I'm going to go ahead and take a listen to your stomach, and then I'll go ahead and palpate afterwards. It doesn't look like there's any abrasions or irritation on the stomach, so that is good to know before I listen. So I'm going to start in the right upper quadrant and then move over to the left upper quadrant, then the left lower, and the right lower quadrants. Just hear a little bit of gurgling, which just normal sounds, bowel movements. Doesn't look like there's any bumps or lumps just by observation. So I'm going to go ahead and palpate your stomach here. I'm just going to do a light push, and you just let me know if there's any pain. No pain? Okay, that's good. All right, so we're gonna move down. I'm just gonna do regular range of motion exercises in just a second here. As far as your gastro issues are going, have you had any kind of diarrhea, vomiting, nausea, any issues? No? And then you did have your meal this morning. Was there any problems with eating, or did it make your stomach upset? No, that's good. So we're keeping you on a good diet, keeping you on track. You just let us know if there's any disruptions to your stomach or irritation there, because we want to be super sensitive about your diet. And so now we're going to move on to range of motion exercises. Everything is good there. I'm going to go ahead and press on patients, on Mr. Mouse's extremities, make sure there's perfect symmetry. Are you able to push up against me? Awesome. Looks like equal strength in all limbs. While doing so, I'm going to assess the patient's popliteal, which is behind the knee, pulse, the posterior tibial pulse, and then the dorsal pedis pulse. And everything looks to be good as far as your pulses, and we're doing it bilaterally to make sure everything is symmetrical. So it looks like everything is working well for you today. No irritation or breakdown in the skin as far as I can tell. I'm going to go ahead and lift the sheet back up for you. And then I'm also going to go ahead and lower your bed and lift the rail back up. And then before I head out today, I'm just going to ask you a couple questions. Do you need to use the restroom? Do you need help getting to the restroom? No, I'm okay. Do you have any possessions that you want me to pull over to you so that they're closer to you? No, that's okay. Okay. And then how's your position? Do you want me to lay you down, sit you up, leave you as you are? Lay me down if you could. Okay. And I'm going to assist the patient with doing so. And then possessions, bathroom. Okay, position. All right. And then, so I've got you all set as you are. Are you having any pain before I leave? No? Okay. So I'm going to go ahead and put this call light right next to you so you have easy access to it. You just press this button if you need us, and we'll be in and out all day. So I'll see you in just a little bit, okay? Okay, awesome. So patient is in the correct position, and I'm going to go ahead and take off. I'm going to close the curtain behind me for patient privacy and exit the room.